Welcome, friends. It is always exciting to see so many people logging in from all over the United States and from all over the world. Wow, I see so many countries here. This is very exciting to watch these live webinars with Dr. McDougall and guests. My name is Gustavo Tolosa, and I'm broadcasting live from Argentina. Dr. McDougall is live from Portland, Oregon, and Dr. Neal Barnard is live from Washington, DC. And it's just amazing to me how technology works when it works. Today we have a legend, Dr. McDougall, of course, who is a pioneer in the movement that we all call whole food, plant-based, starch-centered, and we have a prominent and brilliant figure in the world of medicine as our guest, Dr. Neal Barnard, president of the Physicians Committee for Responsible Medicine. And I would like to thank you, gentlemen, and welcome you to today's webinar. Let's start with our host today, Dr. McDougall. How are you?
Well, thank you. I'm just doing quite well. And we're going to do things a little bit different during the webinars for the next few weeks, maybe a few months, maybe a few years, who knows. Depends on how well it goes over. I pretty much told you everything I know in the 250 webinars that I posted on the website. So I've run out of things to talk about, but I have some really great friends who are movers and shakers in this business. And the first one I have to introduce to you, I met, I believe, in 1983. Maybe he can correct it. I believe he was a resident in psychiatry. Maybe he was still in medical school, but it was 1983. And I believe it was the Hyatt Hotel in Washington, D.C. I was there doing the Larry King show. Dr. Neal Barnard, correct me on those facts.
I think you got it right about right. And it's amazing to think about all that has happened in that time. We're still dealing with some of the same issues, but the landscape has changed quite a lot.
Well, we're going to talk about how the landscape has changed. But you were interested, as few young doctors are. You were interested in diet and other ways that you could cure people with common diseases. You were also very interested in animal rights, which is an emphasis that I didn't have back then, which I have right now. We can talk about my evolution to a more wide-eyed person. So I have you to thank for encouraging me in the direction of appreciating other things than the human body's health, to appreciate the health of the animals and to appreciate the health of the planet. You were very important in getting me to look in that direction. I thank you, Dr. Neal Barnard. He is the president, as Gustavo told you, of the Physicians Committee for Responsible Medicine. If you go to their website, which is a big deal, which is PCRM, Physicians Committee for Responsible Medicine, PCRM.org. And, I think one of the things you'll be struck by, first of all, is the quality of the website. And second of all, you'll be amazed, like with the McDougall website, that everything's free. You go, how can that be? CME credits, everything's free. Well, I think Dr. Barnard has the same problem I have, and that is he discovered a long time ago that real happiness comes from helping other people. So how have things been going? Let's see, since 1983. That's a long time. What is it? It's a long time. I won't even do the math. Dr. Barnard, welcome to the webinar. We're going to be seen by a lot of people who are very, very interested in making the same kind of progress we've made. And boy, oh boy, we need their help, don't we?
We sure do. But thank you, John. I really appreciate your including me in this program. And thank you for all the wisdom that you've imparted to me and to other people over all these years. You're right. I remember vividly our first meeting back 3 and some decades ago here in Washington. And I sought you out because at that point you were a fountain of knowledge. And I wanted to glom onto you and get as much as I could. And you were very, very generous at that time and have been ever since. So thank you for that.
Yeah, but you're one of the, well, I can't say the few people. Everybody in their own way has tried to help people and the planet, the environment, animal rights. And I just happened to get started kind of early. But I stand on the shoulders of some very important people like Walter Kempner, Nathan Pritikin, and Dennis Burkett, and James Anderson, and people you're familiar with. So I'm glad that I was an intermediary in knowledge that is ancient, goes back for thousands of years. And along the way, there have been people like myself and you and Mr. Pritikin and Dr. Burkett, a few others that have discovered this truth. But somehow or another, it doesn't get out. Why?
Well, I do think we're making progress. We had our conference that you have kindly spoken at in the past. The one that we did this past year, we had more than 1,000 doctors come. So there certainly is a growing interest, and these conferences are cropping up all over the place. And you've been a great pioneer there too. I think part of it is surprising when people don't realize that, say, diabetes can be improved, perhaps even disappear, that their arteries can open up again, that they can lose weight without counting calories. And when people learn these things, they get very excited about it. And yet at the same time, there are still a lot of people, including a number of doctors, unfortunately, who haven't yet put this way of eating to work in their own lives. And so they don't feel confident talking with patients about it. But once you do, life is just, it really is a life-changing experience.
All right, this has to be as ununderstandable, if that's a word, for you as it is for me. And that is, the truth is crystal clear in the scientific literature, or in just looking through history. If you're a person of the letters, if you read, you're a person of history. You're just a person who has common sense. It's so obvious that we are plant eaters, and it's so obvious, it's becoming obvious to people that we're destroying the planet by all of our meat eating habits, our livestock consumption. So tell me, you've been at this as long as I have. Tell me, why has the truth not become widespread? Why are the liars, cheaters, and polluters still out there doing what they should be doing?
Well, they have their own platforms. It's not that we don't get a good message out there. It can be dwarfed by other messages, though. For example, it was back 15 years ago when the National Institutes of Health gave our research team a grant to do a head-to-head test for people with type 2 diabetes of a conventional diabetes diet versus a completely plant-based diabetes diet. And as you know, the plant-based diet just was dramatically better. It led to a 3 times better improvement in blood sugar control. It led to weight loss without counting calories. It really became the standard. And not only was it funded by the federal government, the first results were published by the American Diabetes Association in their journal Diabetes Care. We presented it at the American Diabetes Association and everywhere. So it's not that the word didn't get out there. I have a book on it. We did a PBS special that has been viewed thousands and thousands and thousands of times at stations all over the place. However, as you know, probably better than anybody, there are other forces that are trying to get other messages out there. So they'll say, well, forget all that. Just don't eat carbohydrate or do some other kind of diet. I don't need to tell you that the industry fights back too. I'm not making this up. In the state of Texas right now, the Texas Beef Board is promoting, it sends effectively sales representatives or promotional representatives to doctors' offices in the state of Texas, telling them that their patients with high cholesterol should be eating beef. The idea is that I'm not making this up. The Physicians Committee actually has a complaint into the Attorney General of the state of Texas to say you cannot be doing this. But what they did is they do a research study that effectively shows that beef isn't a lot worse than chicken in essence. And so they go around saying, well, your high cholesterol patients may as well go ahead and eat beef. And they have representatives visiting doctors' offices just like a drug salesman doing this. We have asked the Attorney General to intervene. I'll let you know if we win or not. But the point being that why doesn't the word get out? The word does get out, but there is a whole lot of contrary message out there from people who are making money off selling unhealthy foods, and in some cases selling drugs to try to make up for the dietary problems.
Yeah, this trickle-down effect from the food industry goes so many different places. Not only do they make a ton of money selling food poison to people in the form of dairy and all forms of livestock. So you got the big food companies making a lot of money. And of course, you've got the growers selling feed. You've got the people who are making insecticides and pesticides out there making a ton of money. Because of course, you need to grow more grains and more animal food when you produce livestock. And then you get people sick, and we have hospitals making money and doctors making money and the drug companies making money. And boy, there just seems to be no reason at all to be well, at least no financial reason.
Well, I think it's true. If everybody would eat right, probably doctors would have Wednesday afternoons off, and hospitals would make a whole lot less money. But I'm happy to say that there's lots of products that are going in the opposite direction. As you said, some of them are free. Our website at the Physicians Committee, PCRM.org, has been completely revamped. And can I brag about, we have 2 new apps for iPhone and for Android. These are our new 21-day vegan Kickstart apps in English and Spanish. We've had about 600,000 people using the original of these, but they're all upgraded and new, and we're super excited. And I hope people will jump in and do this. It's all free. There's no commercial sponsorship. You can just jump in and have fun with it.
Yeah, this is another place you can go where you'll get done after a week or two searching through the website, and you'll say, "Where's the gimmick?" there is no gimmick. Just like my website.
Exactly. Oh, I have one more thing I got to tell you, John. I got one more thing. I have a new book out.
I don't want to hear.
I have to tell you about this new book. I've written books. You've written so many great books, and I was inspired by that. But I have to tell you, the books I write are so big and thick, you can use them to prop open a door. So I've decided, I've created this new book called the Vegan Starter Kit. And the idea is you can read the whole thing in 45 minutes, maybe an hour. And it tells you everything you need to do to get started, to feel comfortable starting with a plant-based diet. Here it is. There it is, the Vegan Starter Kit. And it's really skinny and cheap and simple. And it's on Amazon and everywhere else, so you can pre-order it. And so if a person wants to know why we want to change our diet, so I can reverse diabetes, I can lose weight without counting calories, I can maybe reverse my heart disease or cut my cancer risk or sort out my digestive tract. And then simple steps to get started, a few dozen recipes, very, very simple recipes that just the idea is to give a person confidence in getting started. And I'm hoping that people will buy 2 copies, keep one, give the other one away to somebody that they love, or frankly, buy 20 copies and keep one, give the other 19 away. I'm hoping that it'll be a way of getting the word out so that it's not mysterious. You don't have to have a PhD or an MD in order to put a healthy diet to work. So anyway, that's the Vegan Starter Kit. I hope people will go on Amazon or Barnes and Noble or whatever and pick up copies, and hopefully we can spread the word a little bit further.
Well, Dr. Barnard, you must have at least 15 books that you've written. How many?
Something like that. Yeah.
How many?
Somewhere along those lines. Yeah.
You can see them on your website. I had a brief look through them, and they brought back a lot of memories of the times you and I spent together promoting the books and taking on different subjects. So there's no lack of information being put out by yourself and PCRM. And I encourage you to read Dr. Barnard's work. And if you haven't picked up already, he and I agree almost 100% on medical practice as well as dietary issues. Close enough to 100% that I can't think of anybody offhand. There's a whole group of us that are so bent mentally in this direction that it's pretty clear that we believe strong that we're correct.
It's also exciting to see these new frontiers that are coming along. For example, as Nathan Pritikin showed, heart disease can be dramatically improved, and he personally showed that it can be reversed. And Dennis Burkett, whom you mentioned earlier, showed that so many conditions like gallbladder disease and colorectal cancer are related to diet. But then this new frontier with Alzheimer's disease, for example, where we're seeing that diet plays a role there too. It's not just age and genetics. Nothing is perfect. These diseases can attack us no matter what. But on the other hand, diet does give us tremendous power for risk reduction. So it's an amazing thing to see what diet changes can actually do. I think the new area, or I shouldn't say new, but new to many people, is inflammation. I keep remembering and quoting your study, I think it was 2004, where you brought in people who had rheumatoid arthritis, and you could show that this autoimmune condition can improve, which is true, and the way you showed it was so elegant. But it's not the only autoimmune condition. There's asthma and Sjogren's syndrome and so many others. And this has opened up a whole new area where research is needed, and people don't need to wait for new research studies. They can try out diet changes themselves. see if their asthma will go away, or their Sjogren's, or their rheumatoid arthritis, or even thyroid conditions might improve with the diet change.
All right. So I still hear you saying, and hedging a little bit, you're saying it's associated with maybe the strongest thing I hear from you is causally related. I mean, come on, Dr. Barnard. When we talk about diet and diabetes, can't you say just clearly type 2 diabetes is caused by eating the Western diet, and it's cured nearly 100% of the time by eating the kind of diet you and I recommend? I mean, I don't want to hear any hesitation.
Yeah, well, it's been an amazing thing. So many people have the idea that type 2 diabetes is caused by eating sugar or eating bread, which digests to release sugar into the blood and that kind of thing. And we've really worked long and hard to try to dispel that notion and to help people understand what is just a slightly more complicated story about how diabetes starts, which is that you have your ham sandwich with mayo and cheese on it, and particles of fat get into the bloodstream, and those particles of fat enter the muscle cells and the liver cells. And when the cells fill up with fat, they make insulin unable to signal effectively. It can't get the sugar out of the blood into the cell because the cell's filled with fat particles. So you go on the McDougall diet or a plant-based diet that's also low in fat. And what happens? The fat starts dissipating from the cells. We call it intramyocellular lipid, but it's dissipating. And then insulin can start working again. And when the insulin works again, it can pull the sugar out of the blood into the cell, and the diabetes improves or flat out goes away.
Yeah, I was just saying, I want to hear you. It goes away.
Yeah. And the earlier...
It's 100% curable by definition.
I think it also depends on how soon I get a person. If a person has had, if the diabetes is starting and they change their diet, it is miraculous to see what will happen with that person. If they've had diabetes for 30 years, I know they can improve. I'm not sure if I'm going to get the disease to go away, depending on the beta cells of their pancreas. If the pancreas has been really beaten up, they're going to have more trouble. But interestingly enough, here at the Physicians Committee, we did a study, 16-week trial, in people who were overweight and many cases insulin resistant, but they did not yet have diabetes. And we tracked not just their weight and their lipids, but we also tracked the beta cells in their pancreas. Those are the cells that make insulin. Those are the cells that when they give up and you can't make insulin anymore, you end up with diabetes. And what we found was amazing. Not only does the insulin resistance diminish, their insulin sensitivity gets better, but the cells in the pancreas that make insulin, those beta cells, start to rejuvenate to a degree. Their function is stronger. So I wasn't prepared to see that, but we published that result a few months ago. And it's been really amazing to see what diet changes will do, and that's one of them.
Well, I guess the confusion for our listeners is we're both talking about the same thing. When I say type 2 diabetes, I'm talking about a fully functional pancreas.
Right.
That produces as much insulin, sometimes twice as much insulin as somebody without diabetes. And what you're describing very clearly that I understand well is something that I refer to as type 1.5 diabetes, where they have partial insulin insufficiency. In other words, they have enough beta cells, insulin-producing cells, to keep them out of the hospital, keep them out of ketoacidosis, but not enough to bring their blood sugar down to normal or to keep the weight loss from occurring. Sometimes they lose too much weight. But yeah, there are a lot of people out there that come to see us who have, as you described, a long-term disease, a worn-out pancreas. And that I refer to as type 1.5 diabetes, type 1 being no insulin production, type 2 being full insulin production and more. I call it 1.5, which is partial insulin insufficiency, as you well described it. I just wanted to make sure our listening audience knew we were both talking off the same sheet.
Exactly, and you know, but even those people that you described as 1.5, even they are going to improve a lot.
Oh yeah.
You know, I would not recommend any other diet for these people other than a whole foods plant-based diet. Throw out all the extra oil and grease, because what are you going to do? You may not get that person off insulin because their pancreas is just not functioning anymore. But what is going to kill a person with diabetes isn't a high blood sugar. It's going to be vascular damage. It's the damage to the blood vessels of the heart. And along the way, the blood vessels to the kidneys or the legs or the eyes are going to be damaged. And that's why they end up with visual loss or amputations. And you don't want to risk any further arterial damage at all. So you want to get all the cholesterol out of your diet, get all the animal fat out, and baby those arteries. And a person with diabetes can live a normal life. But as you said, get to a person early enough when their pancreas is still functioning. And it's amazing. You see people who thought they could never get rid of their diabetes, and it is flat out gone. I was talking with a man the other day who was so proud because his doctor, working at the VA hospital, had managed to eliminate diabetes from his, completely eliminate diabetes from his medical record.
Huh. Well, then, if I was going to say, you are a man who's experienced it, almost as much time as I have, and take care of patients. And I know you do take care of patients. You touch them, you feel them, you talk to them. So you're a real doctor. I'm going to, make some statements, and you correct me if I'm wrong.
Okay.
All right. Is constipation pretty much on? And I mean pretty much. There are always exceptions. Is it pretty much curable with the kind of diet we recommend?
In about 20 hours.
Okay.
Exactly.
So we cure constipation. How about obese people and weight loss? Does it ever fail if some people follow a high carbohydrate, low fat diet? And I mean watching the nuts and seeds also.
Yeah, it's an amazing thing. In fact, we just yesterday finished a 16-week trial in people who joined us for exactly that reason. They were overweight. They had been on every diet known to humanity, and they lose weight and the weight comes back on. And so what we did is we used exactly what you're talking about, completely plant-based diet, vegan diet, no animal products. You also keep the oils really low, focus on whole foods, and you put everybody on your digital scale week by week, and they do great. Yes, you asked, does everybody lose weight? They do lose weight. And if for whatever reason a person doesn't, what I'll always do is I'll say, write down what you're eating. And you look into it and you find the contraband and you knock it out, and it's an amazing thing to see. And the beauty of it is you're not carb counting. You're not wrestling with how many calories you eat. You're not going to bed hungry. You're eating food, but the foods you're eating are healthy. And the reasons for this are, first of all, that, as you know, carbohydrates really don't have a lot of calories, so your calorie intake drops. But the other thing that we found that's super exciting is our patients come in and we put them on an exam table and we measure their metabolism. We actually see how fast they're burning calories minute by minute. And what we find is that their calorie burning speed in the after meal period is actually higher than it was before. And the patients come in, they say, my metabolism is terrible. Now I just look at food, I gain weight. When I was a kid, I could eat anything, but now I gain weight. And they're right. I mean, their calorie burning speed really is low. But when they go on a healthier diet, their metabolism increases, not a lot. In our studies, about 16% increase in their after meal calorie burn, which is a great thing.
Well, our mutual friend, Kevin Hall from the NIH, proved
he's a great scientist.
I mean, he's one of the top scientists in the world. He proved that clearly that carbohydrates result in more efficient burning of calories. And but the low carbers have fought back. The high fat promoters have fought back and have tried to publish scientific literature to contradict Kevin Hall's work. And of course, they've been caught. They cheat. They skew their methods such that they get the results they want. And Dr. Hall's not happy about that. And I didn't particularly care because it was pointed out enough times by other people that these folks, these low carb, high fat, Atkins type people are just plain and simple liars. That's a word we can use these days, isn't it? Back when you and I started, we would never call somebody a liar or a crook or a thief.
Regrettably, it seems to be a word that we're using more often than we used to.
You know what? It's appropriate. Why don't we just cut the speed and not say things like, well, maybe he's misinformed. He's a damn liar is what he is. I don't know why these low carbers are doing it. And it's not just the low carbers. If you watch the journals in terms of medical therapies, devices, heart surgeries, medications, and so on. These people who are publishing in the journals and the scientists who are doing, quote, research are being caught left and right. You noticing that?
Yes. Well, I know exactly what you mean. And here's a concern that I have about low-carb diets that I think people often don't recognize. A person goes on a low-carb diet and they lose weight, which is not surprising because carbohydrates are about half of what your average person eats. If you take out all the fruit and all the bread and all the pasta and all the beans and all the sweet potatoes, and if you don't replace them with calories, you will lose weight, and that happens. But as you know, what you're left with is typically meat. There's chicken, there's fish, and egg whites and so forth left in the diet. And normally when a person loses weight, really almost no matter how they lose weight, their cholesterol will fall. On average, maybe about a point off your total cholesterol per pound of body weight that you lose. Except if the way you lost weight was on a low carb diet, what we see is about a third of people, despite the fact that they're losing weight because they're kind of starving it off, about a third of people have their cholesterol levels go up, sometimes massively. And you've seen this, where their cholesterol levels go really high. And that's because they're suddenly they're not eating the high fiber foods, and instead they're eating meat and sometimes cheese and other things like that. So I really encourage people to not go on this low carb route. And if they do go on it, they end up often disappointed anyway. It's better to start with the foods that your body really was designed for.
Right. Even Atkins reports 70% of his patients had constipation, and about a similar amount had halitosis. And, the studies that you've done, your group has done some of them to counteract the low carbs. In fact, that brings to mind something you and I did together. Do you remember when Atkins died? And a year and a half
I was afraid you're going to bring that up, yes.
Yeah, we got in a little trouble for that, didn't we? Going on CNN, New York Times, and I don't know.
Yes.
All the major newspapers, and you were kind enough to split the duties with me, and also punishment for bringing out the fact that when Atkins died, he was obese, and he had extensive artery disease, which he lied about on the Larry King show, whereas his wife, after his death, put his angiograms up, which showed extensive atherosclerosis. Sad to say, I don't have those angiograms anymore, thanks to a fire. But, he just plain and simple lied about it. And
well, it was a troubling thing.
The point is, you and I went out on a massive campaign together, and we got almost all the media's attention worldwide, including the New York Times and so on. And we told it clearly, this is a fat, sick guy.
It was a troubling situation because Atkins had really gone through quite a resurgence, and people were going left and right onto this Atkins diet, and it was a typical low carb diet where they were hoping that they would lose weight, and over the short run, many people did lose weight. But he promised them that all the butter and meat that they were eating would not hurt their heart, and what he had hidden was the fact that he himself had heart disease. And when he died, he had an autopsy that was performed. And the autopsy results were released to a doctor named Fleming who lived in the Midwest. And Dr. Fleming sent me this report and said, people ought to know that he had coronary artery disease and that he was obese, and because he's been promising that people will lose weight and be thin on this healthy diet. And so we, here at the Physicians Committee, we weighed this situation. We decided that the media ought to be aware of this. And so we did release this report. And we had to weigh this quite a bit because this was an autopsy report that was a technical report, and it would have it wasn't a medical chart or anything like that. But we did make the decision to release it, and I think on balance it was the right thing to do. And it as you said, that people said no, he couldn't possibly have had heart disease, but in fact he did. And
well, he lied about it. He lied. I can remember on the Larry King show him lying about having coronary artery disease. So
yes, yes, and this was in the days when people were less accustomed to hearing prominent people lie like they do now.
Yeah, it was not acceptable back then. That was 20 years ago. That was not acceptable. But today it's a different story.
Unfortunately, but yes, that happened, and I'm happy to say that since that time, I think people have taken a much more jaded view of low carb diets, but they still don't go away. They sometimes remind me of the cicadas that are in the trees here in Washington. Every 17 years, they come out of the ground, and then they make a lot of noise in the trees, and then they go back into the ground for another 17 years. And while they're in the ground, they write books about low carb diets, and 17 years later, they come back with another one. So it was whatever the low carb diet was in the 50s, and then Atkins came up, and then it was after that it was South Beach, and then it was ketogenic diets. But they all have this idea that you shouldn't eat carbohydrates. But the problem, of course, is, as you've written about so eloquently, if you look at the most healthful, longest lived populations, they have high carbohydrate intakes, and they always have a starch food that is their staple, like in Okinawa, the sweet potatoes, or in other parts of Japan, it might be rice. And even in the United States, the longest lived populations are the Adventists, who are eating plant-based diets, either completely or mostly. So anyhow, the low carb diet it seems not to go away, just like any other kind of quick fix. But luckily, the evidence supporting a healthier approach is really quite robust.
The other thing I remember you and I had some fun with worldwide was in October of, I don't know what year, but I know it's October because that's Breast Cancer Awareness Month, which is sponsored by one of the drug companies. You probably remember.
Yeah, Imperial Chemical Industries, yes.
Yeah, okay. And I've written about October every year, the Breast Cancer Awareness Month. It's really breast cancer treatment awareness and prevention awareness and money awareness. But you and I went out on the road. You went to the East Coast, I went to the West Coast. We got together for a few shows. How do you feel these days? I mean, 20 years ago, we went on the road. We went on all the biggest TV and radio shows we could get on. We tried to tell people a very simple thing about breast cancer awareness, and that is that it doesn't do a darn bit of good. Well, no, let's just put it this way. It does more harm than good. And we were talking about mammograms. How do you feel about mammograms?
Okay, well, bad news and good news. The bad news is that as you said, the Breast Cancer Awareness Month was designed to make people aware. It wasn't designed to reduce their risk. And it was troubling for people to realize that the sponsor, the originator of this program, was Imperial Chemical Industries that made medications to treat breast cancer. So their whole goal was to get as many women to have mammograms as possible so that they would find cancer and then initiate treatment. That's all the bad news, but I've got some good news. There are many, many practitioners who have a better approach. In fact, let me right on my desk. Can I show you this? This is a book by Christy Funk. And Christy is a terrific breast cancer surgeon. And this is a terrific book. When Dr. Funk was writing the part about nutrition, she said the nutrition to protect your breast health is a plant-based diet, a vegan diet. And she pulls no punches. So anyway, let me say a word of praise for Christy Funk. She's done a terrific job with that. She's really known as an outstanding surgeon and has worked with many, many celebrity clients as well. But she's a down-to-earth, very sharp physician who tells it like it is. And I've been really, really pleased to see that there's a whole generation of doctors now who really want women to be empowered, to be able to take their health into their hands and not simply be used as marketing ploys for drugs or surgery.
Well, you said there's a good side, and that is this fine young woman who's writing about breast cancer. But two of our friends just basically got thrown out of the business. And those two friends are Peter Gertzke, the head of the Cochrane collaboration. He was fired. You know that, right?
Yeah, I've heard that, yeah, unfortunately.
And H. Gilbert Welch from Dartmouth College, who has spent his good share of his life publishing in the big 5 medical journals about the fallacy of early detection and how we get overdiagnosed and so on. He has been basically censored out of the business by being accused of plagiarism. Now, I know H. Gilbert Welch and I know Peter, quite well to know that these are honest men. And I have to believe the motivation behind their firings and their incriminations was from people who believe otherwise for financial reasons, ego reasons, and so on. So it's not all good, Dr. Barnard.
You're right about that.
Two of the most powerful people in the world, in terms of breast cancer, were just fired.
Yeah, human nature is such that a good message attracts enemies, and people will try to squelch it. However, I've seen two countervailing trends. On the one hand, more people than ever are taking an interest in healthy diets, and to be convinced of that, you just have to go into a health food store. 30 years ago, a health food store was a tiny little place where the cashier was named Sunshine, and they had products that were covered with dust, and they were playing folk music. Today, you go into a health food store, and there are hundreds of people coming in there, and they are looking for healthy products. They want to improve their diet, and they're not playing folk music anymore. And things are changing. There are more products than ever before. There are so many people writing great books and creating great websites that this is a movement that has arrived. I remember 10 or 15 years ago, people weren't sure how to pronounce vegan. They would call it vegan or vegan or something like that. The number of people trying a healthier approach is bigger than it's ever been. That said, the number of people who need help in many ways is bigger than it's ever been too. I mean, there are people eating cheese and eating meat, not realizing that these things are really creating problems for them. So I'm seeing two quite different and opposing trends, unfortunately.
You know, one of the things I've always admired about you is your optimism. You know, no matter how bad it seems, how bad, you know, you always have a smile. You always have a good thing to say about everybody. And I guess that's why you've done so well, Dr. Barnard. You are known you're known by the celebrities worldwide. Your organization gets what, $20 million in donations a year. You stand up. You know, you just have that wonderful personality that gives people confidence and doesn't make them feel threatened. And what a position you've played.
Thank you for saying that, John. I have to say, I don't know that we're optimists. We're not pessimists. But I think what we are is, if we're not optimist or pessimist, I think what we could say is we are determined. It reminds me a little bit after World War I, when people wondered, can we somehow prevent this from happening again? And the League of Nations was beginning. The diplomats at that time said, well, we're not optimists, we're not pessimists, but we're determined. And I think that's kind of where we are, is that we know what we need to do, and we've just got to get the word out there as much as we possibly can.
Well, you know, as a team, and that team involves you and I and other guests that are going to be on this show, like Dr. Esselstyn and Dr. Colin Campbell and Dr. Dean Ornish and Garth Davis. I mean, I got the whole crew lined up for future webinars. What I'd like to do, because I know you've got other things going on, and I do too, and the people are probably had enough of hearing all this confidence that we know what's right in terms of medical treatment and diet. I'd like you to review for just a minute some of the things that you're doing at PCRM. I'd like to hear more about your books. I'd like to hear how people can get involved. I mean, I know you have a big volunteer staff, why they should go to your website. You know, tell us about this, because I think we've piqued their interest in just the short time you've given us.
Oh, well, thank you. For people who are not aware of the Physicians Committee, we do lots of things. We do, first of all, clinical research studies. We've done many of them over the years. It's headed by an endocrinologist, Dr. Hanna Kaliova. She heads our clinical research programs. We're doing studies right now on weight loss, rheumatoid arthritis, and one on dietary cholesterol. Those are all active studies right now. In the new year, we're starting a new study, doing a head-to-head trial of a Mediterranean versus a vegan diet. We do these studies. They're challenging and they're expensive, but they are so important. So that's what we do. We also have educational programs like our Kickstart program that I mentioned earlier. And we do books like this, like the Vegan Starter Kit. Let me make a shameless plug for this one again.
Oh, please do, and we'll make sure we promote it to all of
Thank you. I hope you will. It's online now, and our Kickstart program online and our apps online. And for doctors, we have Nutrition CME, Continuing Medical Education, Nutrition CME, and our annual conference. And we also do a lot of work to try to modernize research itself, so that instead of trying to model diabetes in a rat or mouse, why don't we study diabetes in people whom we can help by doing ethical, careful research to help tackle the cause of that disease. So those are things that we're doing. We're also very active in policy. As you know, we have litigated against the US government to open up the process by which the dietary guidelines are set. Those are the guidelines that determine what kids are fed in schools. And back in 2000, we successfully sued the US government to make sure that process was open and transparent. This past year in the state of California, we got a law passed so that every hospital must serve plant-based meals. Every prison must serve plant-based meals. In 2019, I think we're going back to see what we can do about schools, which often serve not the best foods. We've been very active working with the AMA, which in the past was not very strong on nutritional issues, but has really, I think, made itself proud in recent years by calling for schools and hospitals and other places to have more healthful options, which is terrific. So those are a few of the things that we do, but we are only as strong as our membership, and so I'm very grateful to people who support our work. As you know, I'm a volunteer here. I don't take a salary, and I'm very pleased when people support the work that we're doing.
Well, I've taken more time than we had planned, but I didn't ask you one question. I don't know whether you want to take the time to get into it or just kind of quits for another day. And that is, you've done something that I've been doing for 40 years, and that is you've set up a doctor's office type.
Oh, yes.
Washington. Yeah. And I'd like to know if you have time to tell us, how that's going. Your office practice. Can people get involved? Can they come and see one of your doctors? Is it working out for you?
Oh, it's great. Yes. In fact, we have modeled much of what we do after your own pioneering work. But the Barnard Medical Center is here in Washington, D.C. It's right over there. The Barnard Medical Center is a nonprofit clinic, but we have doctors, nurse practitioners, registered dietitians, medical assistants, and class teachers. And here's how it works. The patient comes in to see the doctor. The doctor says, you've got diabetes. In fact, your diabetes is in poor control. And if the patient is already on medications, we might continue that or we may not. But the key thing is, we then say the diabetes is not caused by a deficiency of metformin or whatever other oral drug you're on. It's caused by foods. So let's address foods. And then the registered dietitians can take it from there, and they sit down with the patient and the patient's reluctant spouse, and they map out a healthy diet for the patient, and they understand why they're making the change. And then the patient says, well, I need a little support. How do I stay on the straight and narrow? We have classes every week that the patient can attend for free forever. So between the doctor helping them understand what's going on, the registered dietitian mapping out their healthy diet, the classes that keep them on the straight and narrow, every single person that I hire in this clinic follows a plant-based diet personally, so they know how to make it work. And it is the coolest thing. The patients love it, but the staff loves it too, because they know they got a whole team backing them up.
Well, I wish you continued luck and success. It's been almost 40 years. You and I have been trying to do something that I know I once believed would be easy to make other people understand common sense and the truth. But after 4 decades, I have to say, I'm not discouraged. I'm discouraged a little bit, but I'm back, and I hope you think about me every time you have some opportunities where you think I can contribute to what you're doing. Because I have to say, Dr. Neal Barnard, you are probably the most influential person, and I don't say this with any casual conceptions about it, because I've thought about it many times over the years. I've thought about Dr. Ornish and Dr. Esselstyn, and Dr. Colin Campbell and Dr. Barnard. You may say it's hard to say who's made the most important contribution, but I'll have to tell you, don't tell Dr. Ornish or Esselstyn or Campbell this, don't tell you. I have to say you have really been most instrumental in getting most people to listen to what's going on. And it has to do with your personality, your uneasy efforts, and your strong belief. And I certainly appreciate it very much. And I know people out there do too.
Well, John, it's nice of you to say that, but I have to be clear that you taught me a lot of the things that I know now. And then you and I have learned together as the research keeps coming out. That's been number one. And I have been hugely inspired by the work that Dean Ornish has done. He's been just a role model for me in the elegant research that he's done. And I will never forget, it was 1991 that Colin Campbell got out of Ithaca, New York, came here to Washington, and stood with me and Dennis Burkett and Oliver Alabaster from George Washington University, where we said we ought to be not requiring meat and dairy in federal programs at all. So Colin has been a mentor, and Esselstyn, Dr. Caldwell Esselstyn, has been just so inspiring with his ability to change things. So all of us have been working together, and you have been spearheading this courageously for a long period of time. And you're right. What you said, the whole world isn't changing. The whole world isn't becoming non-smokers, but they're not all throwing away bad habits. They're not all following a healthy diet. But for any individual, the process can be really easy and really quick. And that's what I'm seeing. So I'm very optimistic for what people can do one at a time. And we are getting closer and closer to that tipping point where everybody kind of twigs the message. It's not just good for our health. As you mentioned earlier, the animals will wave a flag, the environment will breathe a lot easier, and your coronary arteries won't argue either.
Dr. Barnard, I want to thank you very much. I look forward to the next time we have you on the show. In addition to your new book and your older books, which people can get on Amazon, and contact with PCRM, which is pcrm.org. You can go to my website and you'll find some interviews that I've done with Dr. Barnard. And I think you'll find them very interesting. We may even have a lecture or two that you've done at our program. So we've inspired you. We've got your interest, and you know that there's more people out there than Dr. McDougall and Mary McDougall and Gustavo trying to win this battle that's essential. Thank you very much.
Thank you, John. Thank you for including me. I really appreciate it.